Your face is not a trend, it is a masterpiece.
You've been pressed about that situation for way too long.
Don't get me wrong, I genuinely skip the sex scenes. Middle-aged women are taking advice from 18-year-old TikTokers who have no idea about skin.
Will you be my Valentino?
Yeah, I'll be your Valentino.
Oh, yay.
Christian Grey is the reason people got divorced, guys.
No. These women dominate.
Yes, women do dominate, which is very
questionable.
Hi guys, I'm Heidi.
And I'm Biba.
And welcome back to Aesthetically Sisters.
Welcome back, guys.
So happy to be here as always.
Always amazing.
I feel like last week we had such a great session. And
it was fantastic.
I just still feel like it was the best therapy session I've had in a while.
Girl, I'm just glad you got it off your damn chest. Because you've been pressed about that situation for way too long.
I feel lighter.
Like it was like, you know those pots, the pressure cookers. Heidi was pressure cooked.
For too long.
And you know how you like let the seal go and then it goes psh. That was Heidi.
Okay, that was me. Well, I'm released now.
Yeah.
I'm depressured.
Yeah.
And I'm back. I'm 25. I have a fully developed frontal lobe. We've got no time to waste.
I love it.
But yeah, how was your week, doll?
Week's been good.
Bibba copied my top today, by the way.
We're twinning.
She copied me. I actually feel I haven't worn a fitted shirt on the couch before, and the way I'm sitting is making me a bit
Oh, who cares? Girl, you're hot. You're perfect.
It's not.
And you know what? If you have a little roll when you sit, and we're wearing gym tights, and we're wearing tights,
only human.
It's fine.
Yeah, totally.
You're absolutely flawless,
guys. That is the least of my concerns and problems.
Yeah, there's more things to worry about.
There are bigger fish to fry.
Absolutely.
Like our topic today.
Absolutely, guys.
Wait, how was your week before we get to the topic?
We really need to diagnose, we need to medicate our ADHD.
I'm happy having ADHD.
We just don't finish a single fucking topic. We talk about something.
We're excited. We're full of life.
We are beaming.
Yes.
My week, great. Work, as usual. Work. My son, thank you, God, but every other week he's got a new issue I got to deal with.
What's his issue this week?
Oh, he had irritated eyelids, for fuck's sake.
They had to spend 4 hours having eye examinations.
Yeah, like he gave me anxiety, but not he gave me anxiety. I was getting anxiety. Yeah, I was getting so stressed about his eyes. He was blinking too much, couldn't started talking to me.
I felt bad because he was like, Heidi, can we please have dessert? And I'm like, are you okay? Yeah, I just want to have dessert after dinner. And I'm like, my baby.
Like, and she's fluttering very cutely. Habibi, he was like, they were like that. Yeah.
Poor thing.
I know.
But and it's fine. We got it sorted.
Yeah. I got it sorted. Other than that, what else has happened? Nothing.
Well, we do his bloody work.
I work and podcast and prepare for podcasts.
Yeah.
I finished my musalsal. So
not much else is happening. For those who aren't familiar, a musalsal is basically a TV series in Arabic.
Soap opera.
Yeah. It's generally
very
in
dramatic.
Arabic, and they're so dramatic.
But I love it.
Yeah.
I love it.
The drama, the goss
is real. Is real. And like everyone is generally hot. And especially if they're Lebanese series.
Can I just say something? I can't watch a TV series or a movie if the main characters aren't aesthetically pleasing for my personal preference.
Oh my God,
I know that
you're
sounds so
funny.
superficial, but I genuinely won't watch a show or movie if I don't like the actresses or actors.
Yeah.
Not for any reason, but like it just annoys me because I'm like, you could have picked a better character to play this role, especially if I've read the book.
Oh, yeah. That's why I can't watch 50 Shades of Grey. Heidi has been trying to get me to watch 50 Shades of Grey.
I am obsessed with the movie. Don't get me wrong. I genuinely skip the sex scenes.
She's very godly.
No, like I don't care about that. I actually like the movie. Okay. Look, the first time I watched it.
Yeah.
But like from then on, I'm a rewatcher.
Yeah.
And I'm just like, I can't watch them. But the storyline is so good.
I know.
And then like the way that they progressively get more attractive and first movie to the third or fourth movie, whatever it is, they're like the hottest couple. And then now on Valentine's Day next year, they're releasing another movie.
Are they? What,
and no one around me has watched them.
No, you see, okay.
And it's annoying.
When 50 Shades of Grey came out, you were very young. The book.
I only watched the movie not long ago.
So you've never read the books?
I've never read the books.
Okay.
Because I wasn't allowed.
Once you read, of course, babe. You were like 12.
Obviously. And then I never read it. And then, I don't know, I was bored one day and watched all 3 movies. And I was like, oh my God.
So when they came out, I was nursing in the hospital. And I was I was doing my night duties. And I remember I read all 3 books in 1 week. Oh now, you know how much I used to read.
Yeah,
like, I was a big
bookworm.
Major bookworm. Loved it. I still do. I just wish I had the time for it. I just rather watch the musalsal now. So
less brain work.
Yeah, badly. And I watched. I read all 3 books. So, and when you read, this is why I loved reading, because it just like takes you to another world.
Yeah, it's a different type of mental stimulation.
Exactly, and your brain is like creating its own movie and scene of every scene. Like, do you get what I'm saying? And I was feeling Christian Grey, like Christian a bit Grey too much. Like I started imagining that guy in
Okay.
Right, no. Truly, I was like, what a man. Like, what the heck?
Because you read it and then
like,
you're
it ruined my marriage. I got divorced.
Wow. Okay. Christian Grey is the reason people got divorced, guys.
No.
Whoa, that took a turn.
Yeah, badly. That, like, but it made you start thinking. Like, I remember looking at my ex-husband thinking, you're pathetic.
I just don't think you were in love.
Maybe. But, like, certainly. But, like, no, truly, I would look at him and I'm like, oh, I'm not even coming to bed. I'm sleeping in the next room because you can't even do Christian Grey stuff.
This is why it's sinful.
I know that.
Because I know that. It's very sinful.
Oh, trust me.
For a reason.
When I was sleeping in the next room, I'm like, I'm committing a sin here.
Yeah.
Because I just don't want to lay next to that man because he ain't Christian Grey. That's
that is twisted. I love it.
Twisted. That, honest to God, I'm not lying. And so then...
Wait, you actually slept in the other room?
Yeah, for a little while.
No, Bibba.
But no, bro, he was snoring. Christian Grey didn't snore. It wasn't in the book. So...
I really hope you're joking.
I promise to God for a hot minute, like a couple of weeks until I got over the vision started fading.
I'm glad you aren't married.
Yeah. And when they were talking about they're making a movie, they were going to put Charlie Hunnam in there. Now, Charlie Hunnam for me back then, because Sons of Anarchy was out, have you watched it?
I have no idea anything you're talking about.
Okay. Those who have watched Sons of Anarchy would understand my obsession with Jax, Charlie Hunnam. He was supposed to be the main character.
Okay. Is he like good looking?
And his character in the series was like he's a badass bikie, but he's hot and like oh my God.
Boy.
Like
the bad boy you want to be with.
Yes. And anyway, I was so pumped. Like, you don't understand. Like, Christian Grey and Charlie Hunnam, like...
Two worlds collide.
Absolutely. And then, bang, Charlie Hunnam gets dropped. Oh, he pulls himself out.
Oh.
Right? And then they got this guy. And I Googled what he looked like.
He's actually, like, I don't know.
I think he gets good looking because you fall in love with the story.
But no, because the last movie that they have, I think it's part 3, 50 Shades Freed... And they do like a transition at the end of like from the first movie to like there, and they both actually got hotter. So in the first movie, she had like bags and didn't wear makeup. Her hair was always messy. He looked nothing like what he looks like in the third movie. Yeah, and I think it's to show like growth and success and
that
stuff.
Love makes you prettier.
Yes,
it gives you the glow.
But no, when I first watched it, I was like, what the hell? Because in my mind, I was like, everyone's always said Christian Grey is so hot and this and that. Yeah. And I was like, he's not my type, but whatever. Yeah. But then it progressively gets better. So you really need to watch it.
Well, I know.
Because I'm already booking gold class seats.
Okay.
February
but you got to
14th.
understand that's the reason why I could never watch it.
Let's get over it.
I can't because you came to my house not long ago and you played it. for like 5 minutes, and then
But
you
then-
had to leave, and you're like, please watch it. And I lied to you. I go, yeah, I would.
And you didn't. I know
No.
you didn't.
I
Because I went on
can't
to her
connect because
Netflix and it hadn't been played.
an invasion of privacy much. But
Rude.
yeah, I just couldn't because it wasn't. I built something in my head, and I think
Let's break it down a little bit.
yeah,
Let's,
maybe we'll see.
Just watch it.
But apparently, like,
Oh my
okay,
god.
yeah,
we're
we'll
still
watch it.
Going
We'll watch it.
on
We'll watch
about
it. We'll watch it. I'll make you happy. I'll
Thanks.
watch it at some point. But
You have to watch it by February 14. I'm telling you from now.
what
Otherwise,
if I have a date?
with who? Oh my god.
Fact.
I'm not even going out on Valentine's Day. We're going to the cinema.
Okay, I love that. You're my date.
Perfect.
Will you be my Valentino?
Yeah, I'll be your Valentino.
Oh, yay. Okay.
But buy me Hermes.
I will, for sure. All right, let's start what we're talking about today.
Today's topic is exciting because it's quite relevant.
Yes.
And I feel like we really need to just educate you guys on trends and like I feel like we're constantly going back to this.
But I
it's
feel like it's
necessary.
necessary.
So
And relevant.
and very relevant. I feel like at the moment there's
Yes.
like this huge craze on a specific aesthetic cosmetic beauty treatment
yes.
called exosomes.
But
Now,
also, or everything. So we're talking about across the board.
Yeah.
The dark side of like social media influence on
100%.
aesthetic beauty treatment.
I just think it is absolutely ridiculous that
Yes.
middle-aged women are taking advice from 18-year-old TikTokers who have no idea about skin. It's really frustrating
her.
because it is not right. If
Yeah.
you want advice from your skin, for your skin, go to a professional. Go
Absolutely.
to a dermatologist, a nurse who has a background in skin.
Yeah.
Or go to a doctor. Like, listening to TikTokers who are getting paid to advertise a product or a
100%.
treatment is not ethical. They shouldn't, I don't believe that they should be doing it because it is unethical because they're reading a script
100%.
to sell a product or a treatment.
Or they're just literally doing it because they're making us like
$1.
That's it.
And I get it, it's their job, but at the same time, if you don't truly believe in something, I
Yeah.
just don't think you should be promoting it or believe or even know much about it.
Absolutely.
You get what I mean?
100%.
I
and
feel
what is your background? Like
100%.
If-
How much do you really know
know about
this?
skin.
Yeah.
How much do you know about devices
you
to
had a-
know what to promote like laser treatments and stuff, which we'll get deeper into in a minute.
100%. So at the moment, I've seen so many adverse events.
Yeah.
And for those who don't know what adverse events, it's like complications or like things that can go
Go
wrong
wrong.
with a treatment. Now these adverse events are happening a lot because of treatments called exosomes.
Yeah.
So if you don't know what exosomes are,
Hit us, Heidi. Educate us,
exosomes
baby.
are like a type of like peptide growth factor that it's generally like a liquid that we
Yes.
either like put onto your skin topically after a needling treatment.
Yeah.
Or some of them can be injected if TGA approved.
Absolutely.
Now, as we are aware in this day and age, there is so many dupes of everything.
But do you realize the moment exosomes came on the scene,
There was 1,000,001 different types of brands and
every single Tom, Dick, and Harry
Had
butcher
some sort
and
of exosome.
fucking vegetable farmer had
Had
their
an
own
exosome.
exosome.
Now,
come out.
I think exosomes are great treatments for specific concerns,
Yeah.
okay? And there are specific exosomes that have amazing clinical studies
Yes.
and evidence that can prove to be amazing for concerns.
100%.
Online, especially on like TikTok and Instagram, I've been actively seeing the adverse events that are caused by exosomes being misused. Now, sometimes it's not even the product, it's the practitioner.
Amen.
And if you guys have been following along, you know that we speak about this a lot because it's not always the product or the treatment, it's the person performing it. And there's been like a massive trend, and there's a lot of talk about this in our industry, how exosomes are being misused.
Yeah.
And people are getting granulomas formed because of it.
Insane. What are granulomas, Heidi?
So granulomas is basically when you have inflammation in a small area of your skin. So
Yeah.
you have like a treatment done, and for example, the exosome is injected in little like blebs.
Yeah.
So they're injected, you get this inflammation in the area, and it's basically your immune cells that are like refusing this product because it's a foreign product.
Amen.
You end up getting what we
Because
call...
it's not supposed to be injected.
Because it's not supposed to be injected. You end up getting something that we call macrophaging, which is basically all the immunity, like the white blood cells, accumulate into like a rock ball in that specific area. And to get rid of it, it isn't easy.
No.
It's actually difficult. And unfortunately, what we use to dissolve filler called hyaluronidase or Hylase doesn't dissolve it.
No, it doesn't.
Because it isn't a dermal filler. It isn't a hyaluronic acid-based product.
Your own body.
So you need to either get steroid injections, take antibiotics, or have it surgically removed. And it's quite serious.
And very, like, the chances of medications treating it
is very
and getting
unlikely.
rid of it is very, very minimal.
I think it is prescribed to have oral medication or antibiotics to avoid control the inflammation and avoid infection.
Yeah,
because you can get severely infected.
Exactly. And then most times you need to get them surgically removed.
Yeah,
so they've got to cut you up and nick them out of you. But I agree with you, Heidi. It's crazy because everyone is playing like chief in their clinic. What is happening in the industry is companies come to us and
all day, every day.
I just love it that now I've got a reputation in the industry. If you are a rep, do not show up to my clinic unannounced, without a meeting, and very hardly they get meetings. So don't try. Because I'm very, 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 very strict. I didn't want to use that word, but I wanted to so desperately. No, I desperately wanted. I was dying to use that word,
your
but
head
I
out
was
of the gutter, Viva.
I know, but I just didn't want to.
Yeah,
you know, what Heidi said. I'm very like crazy about what I bring into the clinic, so I don't like anyone showing up trying to sell me a product. And this is what their job is all day, to be on the road, driving around to clinics, showing up unannounced, hoping to catch you and to
sell you
a product or talk to you about a product, sort of brainwash you about how amazing it is. Because that's exactly what they're meant to do. And I get it. They're doing their job. I just don't want to hear it. So a lot of these companies are just showing up because every single company, whatever it is, look at device companies now. They're stocking an exosome.
Yeah.
Look at a filler company, they're stocking exosomes. Look at an anti-wrinkle company, stocking an exosome.
We have, because reps always show up to the clinic, I promise to God, we have probably about 6 different brands of exosomes.
Or if not more.
Sitting in our cupboard that we haven't even had the chance to look at, like, honestly.
And, like, we won't even use them on clients.
I wouldn't use them on clients until I've done... Not like only physical research, not even our family. I have to go online. I have to find clinical papers. I have to see the evidence, 100%. The research. What the hell is in the product?
Exactly.
And then trial it and then decide if I like it.
But also, what I also do is look it up on like social media to see which clinics are using it. And you know, the crazy thing is, everyone is posting their exosomes that they're using.
But no,
I'm dying to see a fucking before and after. At this point, I still haven't been blown away by anything I've seen to make me buy it and bring it into the clinic. Now, like, we have a company we work with very closely, and they came and said, we want to show you our exosome topical that you can use, and here's a whole bunch for you to put on your favorite clients. And I was like, okay, sell it to me. I looked at the rep and I said, sell it to me. Now I've got a great relationship with this rep, as you're aware. And she's talking it out the park. They did a massive night, like a launch thing of it. And then one thing she said, and I was like, I'm not buying it. She said, we're the first country in the world to have it. So how am I supposed to fucking know?
Yeah.
How am I going to do with this? What clinical research do you have on it?
There's none.
What trials has been done on it other than the trials that the company is showing you in their pamphlets, the before and after, and very minimal, maybe one article that the person that made it wrote, because anyone can write an article.
100%.
Anyone can write an article, right? And she was like, oh, no, it's quite amazing that we are I'm like, no, it's not. That doesn't blow me away.
Because we are always
guinea
the
pigging.
last.
Yeah, because we are guinea pigging. Like, we are playing guinea pig with this
If
product.
Korea doesn't have it, I don't want it.
Absolutely. Korea didn't even have it first.
No.
Or have it at all. So how am I going to bring this into the clinic and try and sell it to my clients
If you don't believe in it.
if I don't believe in it, or I have not seen what this could do for clients, for patients before and afters, for their skin, for their scars, and for their pigment, and for their rosacea, and for their skin texture? How am I ethically
gonna do that.
gonna feel good about being a nurse? And as a practitioner, my main objective is to serve my clients the best and safest practice.
Yeah.
How is that safe for me? For you,
not.
for my clients.
Yeah.
It's for me and the clients, my
Yeah.
safe practice.
No, 100%. And I think for a lot of practitioners, it's really just like, oh, it's $50 a vial or whatever the price is. I can sell it for $300 and make some money. And it really all does come to
Absolutely.
like your ethics and
Yeah.
your clinical practice. Like
Yeah.
some people are happy doing that and leaving clients with adverse events, but they've made a couple $100 and that's all that matters to
100%.
them.
Yeah.
But it's actually crazy because in Sydney, I don't know if like Melbourne and Queensland are like this. I haven't done much research on this specifically, but I know in Sydney we actually have clinics now led by doctors and surgeons that are specializing in granuloma removal.
That's
because of how
insane.
many adverse events
Melbourne
we're having.
probably does.
Yeah, Melbourne probably will. But yeah, I saw on TikTok just the other, like I think it was like 2 nights ago, this TikToker that I follow, she had an exosome treatment done, and there was apparently a little bit left over, and the practitioner was like, oh, we can actually inject it. It's even better when you inject it, which makes no sense. But they've injected it, and because it's not TGA approved for injectable, she ended up getting granulomas.
There is a reason. If it's not TGA fucking approved,
Why are we doing
there
that?
is a reason the
yeah.
TGA didn't approve it.
Yeah.
That's
And
a
the thing is-
governing body to protect us and the
Yeah.
patient.
And I feel like not even like with this, but with so many treatments, like they're so misused and so missold online.
Yeah.
And then like when clients come in, I'm like, it doesn't do that at all. Like exosomes are not replacing Botox and filler. They're not volumizing.
Say that again. Say it again.
Exosomes are not replacing Botox and dermal filler.
Thank you very much.
Because someone was like to me the other day, yeah, but I got exosomes done at another clinic because we don't have it. She's like, and the nurse said that I'm not going to need Botox anymore. How does that make sense when anti-wrinkle or botulinum toxin is the only treatment
That will
is
relax your
made
muscles,
for
for your
muscles? It's a
wrinkles.
muscular treatment.
Yeah.
No other treatment is going to assist your concerns on a muscular level by
100%.
anti-wrinkle.
100%.
It might help soften your smile lines, but as soon as that muscle moves,
Yeah.
you're gonna have those creases.
Absolutely. I'll tell you how it makes sense. These
Tell
fucking
me.
injectors are coming out of the woodworks, opening clinics, hiring rooms, renting fucking beds, and running a mess in the industry.
Yeah.
Hence why the
TGA.
the TGA and the APRA have really cracked down on us with all the new changes
Yeah.
and the rules that have been put on us, and why we can't put before and afters. This is a prime example because anyone can Photoshop a photo, a before and after, put it on social media and make you believe this is what exosome does.
Yeah.
You're going to come in, drop a $500, get a treatment, and most likely end up a statistic of the adverse events that have
100%.
happened because this nurse has zero knowledge
Yeah.
about what ingredients is in the product,
Yeah.
what the product is going to do if I inject it in the skin. Let's just get, push the envelope and see what happens because that's what most of them are doing.
Yeah.
Okay, because they're so junior, but everyone's apparently advanced on social media now and like senior. I can't deal. And no one actually knows if something is to go wrong, how am I going to fix it?
I was about to say that.
And what are the clinical research? What's the what do I know? Where can I know about what I'm putting in?
I think one thing that differentiates our practice to others is that with us, anytime we're bringing a treatment into the clinic, we will never
are
ever
so
do
crazy,
it
yeah, about-
unless we, for one, know that there's clinical evidence on there. Clinical trials, we see the evidence, we know
White
every
papers.
ingredient in the we want white papers. any rep you ask who I've ever spoken to, I say, send me the white papers. I
Yeah.
won't even look at a product. if
Don't
I
walk
haven't-
into my clinic
I
if you
haven't
don't have
read
white
those
papers.
clinical research, because that's what matters.
Absolutely.
So on top of knowing all that, we then trial the product
Yeah.
on family and friends or clients who we are comfortable doing that with and they're comfortable with.
After we've trialed it on us, though.
Oh, yeah, of
we
course.
always
It's
do
always us and
our
family.
siblings.
Aunties and mums and whatever, and then maybe on a couple of clients.
Yeah.
And then before we even bring it into the clinic, we look, okay, this is how we do it. This is what can go wrong.
And
if
we
this
have
goes wrong,
and we
how
make a
can-
protocol.
I love my protocols.
Yes.
If you were, if you know me, you know my
Yes.
protocols.
Heidi
But
loves them.
everything's a protocol. What can go wrong? If it goes wrong, how can we fix it?
That's right.
How are we performing this treatment every time to make sure that we're not going to cause
Absolutely.
any adverse events? Like it's so much more than just getting a product, buying it, selling it, and making
Absolutely.
money
And how is it the best and safest practice
for you.
for the patient and for us?
Yeah.
We want to make sure everyone is
Yeah.
safe at the end of the day and getting a treatment that's going to benefit them as opposed to them cause an adverse event,
Yeah.
ruin their because you know when people say like an adverse event ruined my life, it's fucking true.
Of course.
Because this is your face.
It's
like God
traumatizing.
forbid something go wrong with my face, we're gonna have dramas. Okay? The world's gonna know about it. I'm not gonna shut the fuck up about it
Yeah.
because your face it's so exposed. It's the most exposed thing on your body.
Totally. And don't get me wrong, I feel like adverse events can happen to anybody.
Absolutely.
We're more so focusing on the fact that people are misusing products and treatments and leading to these adverse
Yes.
events. Like, of course, you can do an anti-wrinkle treatment, have
And-
100
yeah.
years of experience and still have ptosis or get a spocking. Like, these
Exactly.
things happen, they're risks. But unfortunately, when the risks are happening because your nurse isn't being ethical, that's where, unfortunately, it's a problem.
Absolutely. That's why I use the word protecting
Yes, 100.
as
yeah,
much
you're
as we
right.
possibly can from
That's
an
right.
adverse event happening.
Totally.
So yeah, I
We-
totally agree with you.
Thanks, doll. We recently got 2 exosomes in clinic. Now, exosomes have been out for years and years.
Yeah.
And in the beginning, I was so against them. And then the way that people were like, that were trying to sell them was like, oh, you know, you don't have anything that's going to restore and you don't have anything that's going to help, you know, with hair and skin and blah, blah. We do because we have PRP,
Yeah.
which is an amazing treatment that uses your body's own platelets
Yeah.
to restore and rejuvenate. The only reason why we got exosomes was because, unfortunately, PRP is a very subjective treatment. My favorite word.
of the day.
Now, when I say subjective, it means that it isn't a consistent result with clients because it is dependable on your blood.
So and your health.
Your health. So unfortunately, if you're on medications, you don't
You're a
have
smoker.
You're a smoker. You have some medical conditions. Then your blood is unfortunately not as potent and as strong as we need it. So you will still have an improvement, but it won't be the best. The reason why we would ever use an exosome instead of PRP would be if you're one of those clients who has undergone, you know, some medical concern and we want to make sure we're giving you the best result. Exosomes will come in because they're consistent.
Amen.
So we obviously have options for every single client.
That's correct.
But of course, when we brought in this specific exosome peptide, it was like the biggest thing. We trialed it. We made sure it worked. We did so much research on it. And then there was one particular brand where we're like, okay, it works.
Yeah.
It's good. It's
We like it.
consistent. It's safe. And here we are.
Yeah. And we ain't injecting shit nowhere just to not waste it.
No. Like, how do you have product left over? Just needle it into the bloody skin and call it a day.
100%. Just extend the needling down to the neck.
Oh
Then
my Lord.
I know, it's crazy. But that's also like taking it back to where we started the conversation with it being on TikTok. Because, you know, you get on TikTok these days and you can like doom scroll.
Yeah.
Right? And within 10 minutes, you're like, okay.
Down a rabbit hole.
Down a rabbit hole, and you know, I need a new fucking face.
Yeah.
Because the shit that's on there, the things people are saying, there's practitioners left, right, and center that are getting on just talking about, I got this and how to get glass skin. you can't get glass skin because our skin is not made of glass. Okay? So there's no such thing as glass skin. We can try and get you beautiful, clearer skin.
Yes.
Nice, softer, glowy skin.
Glass
but
skin
glass
is just
skin
when you've had a bloody bit of moisturizer on and it's hydrated.
and you've got great lighting.
Great lighting.
Okay?
Take the lighting away.
Take the lighting away, and we're back to looking like, I don't know what you want to call it, cellophane at this point. Like, it's not as glassy. But everything is like a sort of a hook.
Yeah.
It's a promoting hook to try and get the clients
Clickbait.
in. Yeah. She's more tech savvy with the words.
You're doing great.
But even like down to like Korean skincare.
Yeah.
The amount of clients I have coming in saying, oh, I'm on this skincare, I'm on that skincare, I'm on, and it's all Korean. And I'm like, why'd you get off like Eyes Clinical? Or why'd you get off Elastin skincare? Oh, you know, I saw like this person talking about this Korean skincare and it's like made out of like snail stuff and
Mucin, yeah.
whatever, and I'm doing this and doing that, and it was so cheap.
Yeah.
I'm not dissing how amazing Korean skincare is. I'm about to go to Korea in 2 weeks.
Yeah.
Okay, and we'll talk about that in 1 second when I finish this.
ADHD.
No, I will. And like, I can't fucking wait to get my hands on all the skincare. Like,
100%.
I've done her head in, sending her all the stuff we want to go and look at. But we're going to look at ingredients. We're going to look at how potent these ingredients are in the product.
Yeah.
We are not going to bring anything in that just because a TikToker or someone, an influencer or a cosmetic injector or anybody or nobody is just getting on saying this is great or this is that. Or I had a client come in the other day. If you saw her eyelids, I swear to God, they were flaking more than my face was flaking the other day after I went hard on my retinol. And I did that on purpose to flake. But her eyelids,
Oh no.
I swear to God, they were red, they were inflamed, they were sore.
People are putting retinol on their eyes.
Okay, and you know what she comes in and said to me?
It's Korean.
Yeah, she did.
I'm loving it.
Yeah. But she was like, I think I need to do Rejuran. Can you do Rejuran? Like, she came in, she specifically wanted Rejuran on her eyelids,
God.
all above here. Her skin is like paper thin. It's red.
Shit.
It's like, it looked like orange peel, and it was flaking, and her eyes are inflamed. And I looked at her and I said, are you crazy?
Oh, we are not putting a needle anywhere near that.
Do you think I'm gonna come near you right now? Like, we're gonna get you off that. We're gonna treat this situation. She's like, no, I bought it. It's like, it's gonna get better. I saw what it can do. She bought this product. It's being sold as a PDRN oil, for like the eyes and her eyelid. Poor darling.
This is the thing. Like, people are seeing products that it might work for someone. It doesn't mean it's going to work for you.
It doesn't mean it's going to work for you.
I don't have a problem with Korean skincare. Like, I don't.
I can't wait to get there.
I think Korean skincare is amazing because they really focus on skin hydration.
Absolutely.
And as I've said before, and I will forever say, if your skin isn't properly hydrated and it is dry, dryness causes inflammation, and inflammation opens the door to 95% of skin conditions. So we need to have the skin hydrated, which is where Korean skincare is amazing. In saying that, you still need active products depending on your skin type. You can't just throw everything out and go using ceramides and hyaluronic acid and thinking that's going to help your rosacea and that's going to help your acne. It might temporarily, because that's what they do. Using hydrating products make your skin feel good now. But we're not thinking about the now. We're thinking about your future face. Your face is not a trend. It is a masterpiece. What is it going to look like in 5 years?
I'm dead. Like, I fucking love you.
I'm really pressed.
I'm like looking at you in admiration.
No, but like, it makes me so upset because I love it.
There's
actually
passion.
cry.
There's drive in you. There's love.
I really feel it makes me so emotional because we are seeing more and more clients come in with like,
you're so cute. You're actually getting emotional.
I promise. Because it makes me sad. Like, it can be so avoided if they just done their research. Like, there's no reason for you to have an impaired barrier and dry, rough, red skin because you're listening to someone's advice on TikTok.
Exactly.
And they're not qualified and they're being
100%.
paid to say these things.
Yeah. And they're also...
Even if they're a beauty influencer, they don't have a beauty degree. A
No.
company is sending them out a product with a dialogue. We have been sent skincare tablets and gummies with dialogues to do videos on and be paid. But we don't do it because we don't believe in it and it's not ethical.
And we would never like just do that to become influencers. Like,
babe, like I don't even get on and sell my own products to get up and sell
the moment we do one thing, every other company is going to start sending us more of the stuff they already send in.
Yeah.
To keep doing that.
Like food, I'll review. And I'll be honest. But
we need to do one this week.
I'm on a calorie deficit. You're on your own.
Okay. We can
we can
still eat your calorie deficit food.
We can review my mince and potatoes.
Same food every day, guys.
It's so good. Anyways, I'm just really upset because it's sad and people are losing so much hope and
money.
So much faith and so much money.
It's costing clients so much. Like, it's breaking my heart. What I'm seeing the rise of is laser devices. Being misused.
Everyone
clients being mis-sold, informed.
Yeah.
Especially, I saw like I went and got CO2, skin's burnt, went and got skin needling done, but I found it cheap online. So I went to the clinic. They've got scarring like this. You've seen it all.
People just think skin needling is skin needling. I can see for hours. Skin needling is just not skin needling. The needles used have such a different impact. You will get scratching and scarring if it isn't the correct width. Like, there is so much.
There's so much to it. This is why we've created our amazing podcast.
Yes.
And Aesthetically Sisters to be like an educational platform for our clients, for our listeners, for our followers, so they can actually be educated about really the secrets and debunking all these myths.
Yeah.
So you guys know and all these trends, like, you know, I tell you, I saw something the other day on social media. I sent it to you. I don't know if you saw it, but Heidi doesn't open her DMs because I send her about 100 a day.
If you didn't send me 100 a day, I would open and watch every single one.
But there's so much I just want to share with you.
The other day, I actually spent 25 minutes, I swear to God, opening all the DMs. Like every second video was sent 4 times.
No, but that's a glitch. Why would I send it 4 times? Like, are you serious?
I'm like, is she for real? Like,
no, I went back and I looked at it and I was like, what the actual fuck?
Okay.
Anyway, come on. Why would I annoyingly send it to you for 4 times?
I'm being silly.
Maybe twice I'll send it.
To get 2 notifications.
Yeah, and there was a nurse, an actual aesthetic nurse. I don't even know if she's from Australia.
Yeah.
I can't remember. And she had gone to a friend's clinic, had gotten a new device.
I know exactly what you're talking about.
Yeah, which I think was similar. It was like a microneedling.
It's an RF microneedling.
Yeah, an RF microneedling. And this is a few years back. She is still, till now, like 3 years later, still trying to treat her scarring, right? But as a practitioner in the industry, and she was stating as she was in doing the treatment, I started feeling.
She felt it. Yeah.
She felt it. How did you not call quits?
So the RF microneedling device she used, I don't know what energy she was using, but literally caused she had chunks of skin missing.
Of skin and tissue.
So what has obviously happened is because it isn't probably the best RF microneedling device, and this can happen when it isn't Morpheus 8, the energy, as soon as the needles penetrate the skin, the energy sits at the tip of the machine.
Yeah.
So the needles are in and there's all this energy sitting at the surface where we've caused a little bit of ablation. Yeah. It's literally going to fry your skin.
Absolutely.
Morpheus 8 doesn't do this. Morpheus 8, the energy penetrates deep, not at the surface. The needles go in, energy goes with the needles down into the dermis.
Yes.
So yeah.
But yeah, okay, great. Thank you for explaining that, because that's okay. So she's had that damage. Now, the point I'm trying to get across is,
as a practitioner,
she should have known first and foremost. But as the practitioner doing the treatment, that goes to show you not all practitioners do their research, are well trained, are well educated on settings, are well knowledgeable, like how knowledgeable they are about the actual device itself, how to deliver it, and how to avoid these adverse events.
100%.
So this is why it's so important you choose your practitioner wisely. Go to consultations. Don't just listen to these TikToks or these social media or the hype. That every single week there's a new hype of something in the industry. New trend, new something going on. It's so important that they're not persuaded by what they're seeing online, because her friend was apparently a trained practitioner. Yeah. But how trained was she? Because you could do one training day and call it trained. Yeah. Or you could do like 100%. A year of like consistent training. Heidi's been doing Morpheus 8 for how long? Years. And we still attend seminars and we watch webinars and we are consistently learning. We're on their database trying to see their new research consistently to deliver the safest practice.
100%.
And by the way, sorry, it can happen with Morpheus 8 if your practitioner is not well trained.
100%. It can. And there are adverse events with every treatment. Yeah. And the thing is, it's just picking the practitioner who is going to avoid these adverse events as much as possible. And if, God forbid, an adverse event happens, how are they going to resolve it?
Yeah. How they're going to,
there is so much to think about when having a treatment done.
And, how often do you have clients come in and say, I had an adverse event, went back, spoke to them, it's your fault. Well, you're the problem. Literally. Your body done that. It's got nothing to do with me. That's how your body responded to it. Everyone responds differently. 4
days ago, I had a client come in. I've seen her multiple times, and we had a consultation at her last in-Trinkle appointment. Yeah. And we were talking about body treatment. So she's had 2 children. She has a little bit of loss of elasticity. Her skin's a bit loose, a little bit of fat.
That's normal.
It's normal after having a baby. But she's like, I just want to feel like my old self again. I'm like, no worries. We came up with a treatment plan. I gave her the pricing and stuff, and she's like, okay, let me think about it. She comes back 3 months later, and she has gone and she's done, I'm not going to name the treatment, but she had a treatment done, which caused her, she has no sensation in her stomach. Numbness. And she has, in one area, it's flat, and then another area, it's bulging. Yeah. Because the treatment wasn't done correctly. It's probably a dupe of the machine we have. And she's like, I wish I'd just listened to you, but this place had a promotion, and I thought if I went there, it's the same thing. And they said it's the same thing as Morpheus.
No, it's not the same thing.
It's not.
And the practitioner is not Heidi. So you're not going to get the same delivered results.
Amen. But unfortunately, cheap is never better.
No.
I'm sorry. No. Even with clothes, don't get me wrong, I love a good sale every now and then, but am I going to buy a $10 top and wear it a couple times before it wears, or am I going to buy a $100 top and wear it for 10 years? Let's be so for real. Badly. Let's be so for real.
I agree. 100%.
Your face is something you shouldn't cheapen out on.
Or your body.
100%.
Any kind of device treatments, any kind of treatments you're walking in that are aesthetic related, beauty related, pill related, any kind of related, you need to actually do your practitioner's head in, with questions.
When clients ask me, I'm sorry, I have so many I'm like, ask. Pick my brain. Let's just sit and talk for 20 minutes, 30 minutes. I want you to understand the treatment at the same level I do before you go ahead with it.
I love clients that come in and they say, sorry, but I just need to pull out my phone and ask you questions in their notes. And then the ones that actually come in for the consultation, not do the treatment, but come in for the consult to learn it, to understand it. And I love, especially for example, when I'm doing noses, when clients come in and I feel like they're sort of anxious, I'm like, you know what? We're not doing the treatment today. I want you to go home after I've given them all the information, marinate in it, take it all in, come up with more questions if you have. Sort of know that I'm here, call, email, DM, whatever, text us with any question. And when you're absolutely 100% ready, you come back and we do that treatment. Amen. Because we're not doing it until you are 120% sure you want me to come at you with that syringe. Which is what our other clients do with their devices. Yeah. And I love that.
Yeah, come pick our brain, get comfortable, and then have the procedure done.
100%.
Because don't spend all this time, money, and effort doing these things, and then you not get a result, or you have a worse reaction, and have to spend so much money on revision.
That's correct. That's correct. And who cares if it's fucking trending? If your face burnt is not going to trend. I'll tell you that much for free. Right.
My favorite line right now. Your face is not a trend. It is a masterpiece.
Hey,
Stop treating it like a fucking trend.
Absolutely. 100%. I love it.
Oh, well.
And we build coliseums in this clinic.
It's a process, guys.
Well, Rome wasn't built in a day, honey.
It wasn't.
It wasn't built in a day. That Colosseum took so many days.
Amen to that.
So we love that.
We do. Well, thank you so much for tuning in. I hope you learned just one thing from this.
At least one thing, and we'd be happy.
100%. And if you have any questions relating any treatment, you need advice, you've had a treatment and you're not sure, reach out to us. We are always here to help you.
Yes. And we cannot wait to welcome you into the clinic and provide you with the safest and greatest practice ever.
Amen.
And give you that perfect skin. Maybe not so much glass, because that shit don't exist.
Let's be realistic. Now remember, wherever you're listening or watching, make sure you're following and subscribed so we can continue bringing you new episodes every week. We love you.
See you next week.
Mwah.